Welcome to Hot Takes, a series from Red Hot Healthcare that delivers thought leadership to viewers and listeners in under 12 minutes. There's no softball questions or sales pitches from our guests, and I'm your host, Steve Ambrose. Today's hot take is from Tom Foley, the Chief Growth Officer at Genie MD and a well-known thought leader across many healthcare segments. Welcome to the show, Tom, and love to see if you can give our audience a bit more about your background in healthcare and what you're doing now at Genie MD.
Steve, thanks very much for having me on the program. Very much appreciate it. Yeah, my background, I've been in healthcare for the last 23 years. It has swung across the healthcare continuum, if you will, from working with pharma in developing brand.com websites to CME type of programs, moving into EHR, interoperability patient portal type of efforts, working with EHR vendors. And now I am, in the last 6 years, I've been very much involved in virtual care initiatives.
With all this buzz going on about generative AI, where do you see it most impacting virtual care services and then also maybe patient outcomes as well?
Yeah, I think it's a great tool, but it is healthcare, and we need to be handle it with maybe a bit different set of gloves in the context of GPT. Asking a general question such as how many Tylenol can I take a day, it'll give you a specific answer. But in healthcare, it's important to put your questions in context. So if I have high blood pressure and I'm on specific medications and I have other chief complaints and I ask the question about Tylenol, GPT, so if you ask the question in context, GPT will give you a completely different answer. So you just can't use it as a generic tool. So, but the integration of a GPT-like platform, AI platform, with your medical platform, virtual care platform, and or even EHR for that matter, it becomes now potentially a personal guide. So if your doctor's not available, you want to ask a question, you can get some very specific answer as long as it's contextualized and therefore personalized to you. That said, what we also need to be cognizant of in these tools, because it is healthcare and lives matter, and that is, what is GPT trained in? What is the data? Is it credible, evidence-based data that GPT is trained in, and therefore giving you a credible, evidence-based response? Again, the consumer is not all aware of the mechanism in and of itself, but they think the tool is cool, right? But it's our job as the implementers to make sure that it's safe relative to its use in a healthcare setting.
Yeah, there's been some pushback from, of all people, Elon Musk and others now that are talking about pulling in the reins on generative AI and related large language model technologies. And I don't know how successful, candidly, that's going to be. I almost feel like, Tom, that the genie's out of the bottle.
Yeah. Well, yeah, it is out of the bottle. I don't disagree with him in context of we now have to establish policies in the context of, okay, or at least have it posted that, or in some way making awareness that GPT has been trained with this type of content. It's got to have some credibility behind it versus throwing in everything that CNBC says versus Fox News versus First Nation, right? You're going to get a different response. It's got to be credible. So, yeah, let's take the bias out and let's have a real honest, beneficial tool for the patients to use. Because at the end of the day, our number one challenge in healthcare, older age or sicker population, less doctors and nurses. Patients need access to information, and this is where the GPT type tools will become a very valuable asset moving forward.
Tom, let's jump into value-based care. Now, look, value-based care has seen a lot of adoption in primary care, as we know, but a lot of organizations remain really heavily grounded into fee for service, especially when we get into the secondary and tertiary care services. I mean, they're not running to value based care with those services. So, do you see any sort of way to really bring more value to provider organizations that, at least on the secondary and tertiary service side, have just decided to stay a lot more rooted in fee for service?
Yeah, I'm a full believer in that value-based care can provide. I'm sorry, you can provide value-based care within a fee-for-service model, and I often have stated that I'm not quite sure why a provider would want to go at risk relative to its revenue model when you can perform equal to or greater than delivery of care models in a fee-for-service. And so let me explain. Right now, when a provider wants to make more money, and there is money attached to this, right? They want to make more money, so they get on the hamster wheel and they start to see more patients, right? But the more patients is impacted because they see each patient less, and that's a problem in and of itself. The question is, how do I extend care from my brick and mortar facility to the home, and how does the home become a new and enhanced setting of care? And virtual care is that equation. At the end of the day, I see a doctor sees a patient uh, 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 very seldom, once a quarter, once a year, once every 6 months. I'll see you later. And so now they come back into that second visit and they realize the patient was totally non-compliant with the previous guidance. Right? So we're not getting any place in that model. I often ask the question, the average Medicare patient, 5 chronic conditions, 9 different doctors on their care team. CMS data says that they only in front of their doctor 15 hours in a given year. The question on how we deliver better quality care is figuring out how we engage the patient in the 8,745 hours that they're not in front of the doctor, because that is where wellness is established. So virtual care services like remote patient monitoring, like chronic care management, like remote therapeutic monitoring, these are all new ways, new in the context of now being embraced because the pandemic taught us that virtual care services is great. And Mikey likes it, if you will. In the context, the doctor likes it, the patients like it, and there is profitability in it, but at the same time, I always talk about outcomes. The doctor can realize financial outcomes as well as clinical outcomes, and that's the importance. So I can improve medication adherence. I can improve whether or not the patient is on the right meds at the right time, and I can improve. Each event relative to remote patient monitoring is an intervention point. And those intervention points create the opportunity to engage that patient and take action so that they're not in the emergency room and they're not being admitted to the hospital. So virtual care is a way of how do I engage those patients in that 8,745 hours so that I can improve their healthcare, so that the next office visit that they have, we can demonstrate progress as opposed to no movement at all. We are in 2023, and with all the inventions of healthcare, all the innovations of healthcare, we now have more patients with chronic conditions. More people have diabetes today than yesterday. More people have cardiac issues, chronic care conditions than they did yesterday. We need to change the way in which we do patient engagement in order to change the trajectory.
Well, last question here, Tom. If you could snap your fingers and fix just 2 challenges in health equity, what would you fix and how?
Well, if health equity is defined as the every patient or every consumer has equal access to care, and as quite honestly equal access to a cure, then I don't believe health equity is the issue. I do believe that there's inequity in the delivery of care, but if I am a Medicaid patient, a Medicare patient, a Medicare Advantage patient, and a commercial payer patient member, and I go to the doctor, and will I get the same level of care? And if the answer, and will I get the same level of access to a cure? If the answer is yes, then let's go to the cheapest payer, and everybody should use that plan. And if and the folks in Washington believe that that's true, maybe they should get off their health care plan and go on to a Medicaid plan, and see the reality of the lack of access that a good portion of our population don't have access to the right care.
Yeah, that's really interesting. A lot of times I feel like that I read, and I'd like to get your thoughts on this, where health equity is many times put out there, and it's certainly very noble, very needed, but it doesn't always translate across the ground level into real results and real change in the way that we're seeing providers operate. I'd like to get kind of your thinking on that.
Yeah, I mean, there are pockets where we can improve health access to care. There's no doubt. To say that we're going to achieve this end goal of equal access, equal care, equal outcomes is just not, in my view, a reality in what we will see as far as outcomes in this campaign. There again, we have with all that we did, we have more people with diabetes today than yesterday. More chronic conditions develop every day. We have an older, age, or sicker population with less doctors and nurses on how to deliver care. How are you going to now increase the access and have less doctors and nurses available to treat an older, age, or sicker population? It's just the metrics aren't there. The numbers aren't there for the reality of this end goal to happen. And I will add that when Washington talks about healthcare reform, regardless of whether it's whatever president care you want to go to, we only know two things will happen. The doctors will get paid less, and the consumer will pay more. That is all that's going to happen in any healthcare reform.
Tom, it's really great to catch up with you. Just thanks for stopping by, sharing your thoughts with us today, and being on the show with us.
Awesome. Thanks for having me. Appreciate it, Steve.
And thanks to those watching and listening. You can subscribe to Hot Takes and get every show update by visiting redhothealthcare.com. Thanks, and have a great rest of your day.